May is Mental Health Awareness Month, and all week we're highlighting conversations and resources surrounding mental health and wellness. According to the CDC, 1 in 3 seniors report feeling lonely.
Aww.
The California Department of Aging says 40% of older adults in our state say they feel lonely or isolated. Experts say it is important to keep seniors engaged to help them stay healthy.
Maral Karaccussian is the director of the LA County Aging and Disabilities Department. She's here to discuss the local resources to help keep older adults connected. Maral, thanks for being with us this morning.
Thank you so much. It's really always so happy to be here.
Yeah.
It's funny because social isolation is something we're talking about it as an epidemic, right, from a public health approach. But how do we actually tackle it for older adults? Because I don't know if you've engaged with older adults. It's like, how are you doing? I'm fine.
I'm fine.
I know.
The other thing I'm noticing about older adults, hello mom, out there, is that they seem to be getting a lot of their connection through social media, but not actually talking to the people on social media,
just
seeing.
Right.
They're seeing, or they're posting something, or they're looking at photos, or they're getting misinformation. But that's neither here or there, right? That's a whole other segment.
Yes.
But I think part of it is that we are in the it's funny because it's like sometimes I feel like they're teenagers too.
Yeah.
It's like put your device down, dinner's here.
Right.
But I think it's a good opportunity to also engage, and you can have friends, but you have to be careful of financial scams and other scams and
so am I
fish
putting
bait.
limits on my teenager and my mother at this point?
Possibly. I think there's just a lot of education that we need to do with our older adults. But I think at the end of the day, it's about building community. So what does that mean? Does it mean you build community in a virtual world? Do you come to a senior center?
Right.
Do you actually call your friends and family? Do you call your siblings? Do you actually, I don't want to, and I've heard a lot from older adults, I don't want to be a burden.
Oh, yes.
Well, they don't want to be a burden.
Correct.
Oftentimes, as we've said, we notice what's happening. You talk to them about it and they deny it.
Absolutely.
How do you get through to them to acknowledge that something needs to change?
I think it's hard as the child or childlike, right? Because you're like, this is my parent, this is my loved one.
Sure.
How do I have patience with them and actually ask them questions that you would probably ask if you have a kid? You're probably asking, you want them to be emotionally intelligent and sound, right? But with your parents, sometimes you're like, I don't have patience with you. What would say what you mean and mean what you say?
Right.
So how do you have grace and just kind of evolve and just engage with your family member as if be inquisitive, ask questions. May is Mental Health Awareness Month, right? So it's like, what does that actually mean for the older generation?
Right. Here's something else I'm seeing. I'm seeing older Americans wanting to stay in the workforce as long as they possibly can.
Absolutely.
Because I think there's this fear that they're going to get out and they won't know what to do with themselves.
Absolutely. I mean, and that's the question too, is like, what happens when your kids have moved away, when you don't have access to transportation, when language is a barrier, we have 61% of older adults who live alone, or maybe I butchered that stat, but we have a majority of Californians who live alone. So that is a projection and a trend that we're seeing. So how do we work as a government entity and really seek people out and say, hey, come to our senior centers.
Right.
We just had a Mother's Day event. There was a sewing class. They just had a fashion show at one of our senior centers. So it's building community, it's building a network. One of our other senior centers, they have coffee and conchas in the morning. So it's really so it's really cute to it's cute in that sense where I'm like, oh, okay, if I retire, is this something I could be doing?
Yeah,
absolutely.
Right?
How do you reach the people though who probably need it the most, right? Because you have us who I imagine at 90, I'll be like, yes, bring me over there so I can dance and talk to the people. If people are more resistant, how do you convince them that this is something they need?
I mean, all we can do is probably target them on social media. Ultimately,
make sure you get in that feed they're scrolling through.
Micro target them. As for my communications team there, shout out to them. But go to websites, go online, see what opportunities you have for community building.
I don't mean this as a joke. I truly don't. Do we need to remarket the word senior? Because I feel like there are so many people, like my mother, who is 70 years old,
and they don't want to be called
she
senior.
doesn't want to be called a senior.
And I understand that.
Can we rebrand this somehow?
Absolutely. I mean, and I think we're the Aging and Disabilities Department. Do you even want to be called aging?
No.
Right? So exactly.
Right.
So I'm like, that's the reality, is that I think we just age gracefully, right? There's organizations, seniors aging gracefully everywhere, right? So I think there's a rebrand that does need to happen.
Especially for the boomers.
100%. And so what does that, how do you age gracefully? And how do you age not in isolation? And we realize if you're socially isolated, it leads to mental health issues, physical issues, really just could lead to dementia. So, what are you doing right now to be proactive and not just wait for someone to just come and knock on your door? So I think there's a lot of means, a lot of opportunities opportunities. We have a lot of senior and community centers throughout this entire county. Our department runs 13 of them. So we have like chair yoga classes, Zumba, we have the sewing classes, and just a lot of opportunities. We're trying to meet the needs of people who are showing up.
Mature recreation center.
That's absolutely, as I just fell into that right there, right? I was like, we are due for a refresh and a rebrand on what we call our centers.
A mature party area.
Or just community hubs. Maybe people will show up just saying, this is a community hub. It's a resource center. It's somewhere where you can socialize. So I think it's really important to just kind of put this out there and know that there are resources out there. You're not alone. Right. And it's really just important.
Don't be afraid of it.
Don't be afraid of it. And, as a teen, my parents were like, do you want to go to this Armenian activity? And I was like, I'm scared. I don't want to go alone. So I know that. So how do we, as a system, as a county, as an entity, really create like a buddy system, peer-to-peer support? So you're like, hey, I'm going to this, come with me.
Sure.
So maybe that's something we need to think about strategically and with intention.
Absolutely. Well, you're doing some wonderful work.
Thank you.
We hope it spreads. Maral, thank you for being with us this morning.
Thank you so much.
CBS LA cares, and we have posted mental health support and resources on our website. Just go to cbsla.com/mental health.